Playbook by CEO East Africa Magazine in association with FCCA Uganda and Deloitte.
Welcome to the CFO Playbook, a production of CEO East Africa Magazine. In this show, we get to talk about finance leadership, trying to dig deep into the minds of finance leaders in Uganda and hopefully very soon in the region, and understand the profession, understand the trends, and in there also be able to inspire upcoming leaders, but also gets the world to understand the finance profession better. With me today is Robert Kakooza. He's a man, he's just been telling me he changed roles recently. Right now, he's a new head of finance administration at UNBS. But of course, we'll be asking him a little bit more about himself, tell us more about himself. And of course, before we dig deep into the show, I would like to thank our partners, our faithful partners, FCCA Uganda and Deloitte Uganda, with whom we are partnering to bring to you this show. Robert Kakooza. Yes. Tell us about you, sir.
I started my career in banking. Later on, I joined the austerity sector. Very few people know about that because I was there for a short time. And then I went to oil and gas. Okay. Now, oil and gas, of course, opened up to me the private sector way of doing things, looking for the bottom figure, make sure that it works very well for the shareholders and all that. And then I joined Sunday Hospital, where most of the people had know me because I spent there over 9 years. That was head of finance. From there, I joined One World Health. And then currently, I'm serving as head of finance administration at UNBS. Yes, that's from my career path. I am here, and I'm a family man, married with 3 children. And I look forward to post for more as an African family man. Yes, and I'm happy to be here. Okay, yes.
Interesting. Finance person looking for more cost basis. Interesting. Being a CFO of a hospital, I realize that bewildering patients who have not paid their bills. It must be a difficult decision of somebody who is sick. They have a problem. You must deal with them, but at the same time having an eye on the numbers and sustainability. How to prepare yourself for such a delicate position?
It's complicated. I'll tell you the truth. It was very difficult for. Good thing is in Zambia and One World Health, from where I won the award from, we're all in health sector. But I'll tell you the first 2 years of my career in healthcare were very difficult to tell somebody you can't take a body for your dead loved one because the bills are not faked. But look, you must then buy the supplies to treat other patients that are available. But at the same time, it goes back to a little bit being flexible, yeah, and understanding and being as flexible as possible and listening. Some of the things that happen that you hear in the news that somebody has definitely been refused to move because there's no proper communication between the loved ones that have lost somebody and the organization or management. People come shouting, people come insulting you, and you sit back. But then there's somebody who comes with a plan. But this has happened. I vote my deal will be 10 million. I vote it is 15. What do you think I should do? So it's a communication issue that sometimes we lack as human beings to approach difficulties that we face. But I'll tell you that hospitals also lose a lot of money in those ventures, where you have no choice but to let the patients go or to let them take their loved one after serious communications and engagements. And people never return. People never come back. So hospitals write off a lot of money in such things. But preparing yourself for such a role is something that takes a lot of patience, a lot of communication and understanding different stakeholders and how we work. But also you must cut your losses. So as a finance person, if I lose 2% and you pivot me 98%, I am not able to manage it. So you must balance between the cost and benefits of the patients and the going concern with it. And you move forward. Yeah.
I'm told banks do factor the non-performing loan ratios into the interest rates. Do you guys also factor those bad debts within the hospital fees that we pay?
Definitely, a finance person will tell you as you do your pricing model, you must ensure that you factor in the fact that you will lose some money. And that's why bad debts is for us an experts that we take to the boardroom and communicate that you lost this money because of the foreign reasons. But as I say, that is already factored into our pricing model. It is only at a point where, like, if I cross this line, the business is where it fails. So it must have the line it can't cross. So if I say your bill is 4 million and you give me 3.5, I can be flexible because I'll get the 500 from an amateshi. Yes, or from other services.
You remember somebody who said that these vendors who work selling things, that's how they're able to balance. Today, you got to get an incredible deal from a vendor and buy something for 10K or 5K. And for you think you made a deal, yet there's another person who has paid for the same thing of 10K, he has paid 20K. So then that way there is a kind of balance.
Yeah, your services must be services that you understand as a finance professional. So for example, hospital said, you're not going to make money on drugs because the margins are very small. I can't purchase Panadol from TMS at 50 sheets and you expect me to sell it to you at 300. I'm definitely going to sell it to you maybe at 70 sheets. So the margins are small. So you must therefore look at services that are going to bring you money. And of course, in hospitals, it's mainly diagnostics, the x-rays, the radiology services, the labs. Those will give you some money, the surgeries. So if you bring a bill and honestly you were in surgery and your surgery was for me and you paid it all and the drugs are 100,000, I'll let you go. Honestly, I'll cut my horses. But I'm not going to let you go if you just came to say, doctor, and they said you take drugs and you know where to pay for them. Because then I'm giving you the entire cash to. So I think even the traders balance it like that. You understand your services, not the cash cows, not those that are going to perform very well. And make sure the cash cows, you don't let them out of the meter. And it takes for. That's how you manage it.
Yeah, it is. I'm watching in the finance department of hospital, which might make things more like you're out in the kitchen because you're supporting everybody. And I also must admit that in the healthcare, especially hospitals, is a very unique place. Do you feel you pick certain special skills that have hardened you and made you a better finance person, and maybe it face the future?
Very well. I mean, you pick a lot from the health sector. You become resilient. I mean, the first question you asked of me telling you, look, I'm sorry, you must pay. For example, you can't bring your wife to deliver and they let you go. I mean, it's been 9 months. Where have you been? So you learn certain attributes of managing the business with a hard skill. And every CEO might need such a finance guy. Otherwise, you might make the company fall down. So you develop some bit of hard skill, but also the other thing you learn in there is we are different professionals. So you learn to work with different professionals. You learn to work with somebody who is happy that their patient is fine and it only want is for them to go back home, and I'm talking about now the doctor. But then you balance with you who is like, okay, thank you, doctor, but you have other patients who need these supplies, so I'm not letting this patient go. And you also need a salary, because when they need the salary, they will not understand that you let some patients go. You get my point?
Yeah.
So you learn how to deal with people. You learn how to deal with different professions. You learn negotiation. There's a lot to do with negotiation with different stakeholders, communities around that you serve. Take healthcare sectors to be their own. So you must be in position to know what are their needs, and you learn relationship management to them also. So yeah, it helps you to manage other areas better.
Somewhere out there is someone who has some money, like say in Uganda, and they are asking themselves, okay, where should I invest? maybe somebody had money and they wanted to invest in a hospital, or maybe they invest in a hospital and it's troubling. From a finance perspective, where would you, let's say, if I invited you to my hospital and it was struggling financially, where would you begin looking?
I think investing in healthcare is really a choice that is not very easy. And I really applaud people out there who make decisions to invest in healthcare. Because for me, I think it's really more of a social service than a profit-oriented service. I think when you go in there looking for money, it may be very, very difficult for you. You might get disappointed, at least for Ugandan economy. Other economies may be different, like Kenya, where healthcare is big at insurance level. I mean, insured patients are over 60%, so they will pay. So investors in healthcare really should be empowered because it's not easy. But for me to advise on areas to focus on for you to realize your dreams as an investor in healthcare, I think the first one must be in getting the niche of the services that you offer. Without mentioning names of different hospitals here, we know where to go if you have a heart problem. We know where to go if you need dialysis. We know where to go when your child is sick. So, where you may offer all the services, it's important to have a niche. If I used banking, for example, we know in the banking sector, Standard Chartered banks, and you walk into Standard Chartered when you are that category, because it has a niche in that. So even in healthcare, you must create a niche. You must say, I am the best in diagnostics, or I am going to offer specialist services, but you may not offer only. That is very important so that you can attract as many as possible in that niche. You too is your pricing model. You need to understand the economy you're working in, the marketing you're working in, the disposable income of people, and being positioned to price your services in such a way that you can attract all kinds of patients. And usually what we do in such a way is that we can create a C-suite for the people like you who can take consultation of 150,000 specialists. But it's also okay to create a niche of some other patients that can afford to pay consultation of only 30,000. So segmenting services through a very good price model is important. So developing a niche around which services you're known for, segmenting your services in terms of the pricing you do, but also most importantly is quality care. Who are the people you employ? You know, hospitals are failing money, mainly not because they are not looking at things very well, but because of the quality of care they are offering. The quality of care determines the profit of a hospital. Do you walk into this hospital and feel like the nurse will come to it very well? Cool. There's a place I used to go to about 10 years ago for the health care. And I would walk in and I feel better. Just that, the environment, the welcome, the water, the coffee. And then there are places you enter in and you paid your money and they're like, nobody has seen you.
You feel sicker.
Yeah. And you wait for 10 hours. That will definitely make you beg. However cheap you are, however good you are, a doctor, that will make you beg. So I think for me, those three are very important. And CFOs tend to just concentrate on the figures, but these are things we need to look into deeper to create it.
Maybe I just want to learn a little bit about your journey in the finance profession. But just before we get to that, I know you just joined a new workplace. Yeah, that's UNBS. And so something that comes to mind. How do you, I mean, everybody was in a certain place and they feel maybe there's a time for me to move on and everything. But how do you package yourself to win an interview? I'm sure this must have been very competitive. Have you had a chance to think back and said, okay, how did I package myself to win this interview? Perhaps did what you all also contribute to that? I want to put some those, maybe the sound of them should be doing an interview. And I'm sure you still have some memories on the whole process. How do you package yourself to win an interview? How do you even manage the transition? Especially senior management, you are the top, and you can't just wake up and go. You have to communicate that decision, and which is a hard, is a hard thing to do.
A great question. Because I left Zambia in 2022. At the start of 2022, worked with these colleagues of mine and the NGO One Heart Health for 2 years. And then I moved into public sector at UNBS. So, yes, that means I've done interviews and I've been successful. And it's a great question to help our CFOs out there looking for top jobs. I think for me, I'll be honest, it is preparation. Preparation, research. And then there is something that we fail these days to believe in, but I call it manifestation. If I see a job advert today and I feel I love the organization, I will think about it for at least 2 days. Why do I need to join UNBS, for example? Is it something that I'm going to contribute to? Will I be of value? I ask myself those questions before I write the cover letter. And if I am convinced that I'm going to definitely apply, it is those questions I've asked myself for 2 days that will inform my cover letter. Because my cover letter then will be about what value am I bringing. It can even be 1 page, but with 2 or 3 points of which value am I bringing. If you hire me, this is what I'm bringing on the table. 2, the other mistake that we usually do, which we need to improve on, that I have seen that has given me jobs, is we must tailor our CVs to the job and to achievements. So we've been writing CVs as CFOs as, I do this, I do reporting, I do this. No, you must put your CV in such a way that I have achieved the following things where I am. And I can do even better where I do. Why? Because you have the following infrastructure to help me even do better. So you write your CV in such a way that you're showing what can you do for us. Then if you manifest that this job is mine, trust me, you're going to prepare as if you're there. Because you're going to prepare for all the possible interview questions. You're going to read about what UNBS is struggling with in public image, in financial reporting, with the government. Why are they in park? Why are they in parliament? And all your questions are going to be, I'm coming again to stop this. And the challenge or the problem we do usually, I think, is we go to YouTube, we go to Google and look for questions of how do you prepare financial statements. It's not going to get you a interview at this level of CFO. No, it's not going to get you a job. You should prepare for questions of how do we stop going to park for bad news. So you must be able to prepare answers around that. Even if they ask you a question that is related to something, bring it, squeeze it into how you're going to create for you. So for me, I think that has helped me a lot, and it helped you a lot with this character. I was able to explain what I'm bringing on the table.
Okay. There's something you mentioned about, how do you stop going yourself to the park? It takes me to a reputation management.
Yeah.
And I know recently, and not even just recently, but there's this been like it's kind of like the professional rivalry between marketers and finance people. Yeah, marketers feel that finance people don't want to invest in non-tangible things like reputation and brand and as a CFO, how do you approach certain things that are non-tangible, especially in terms of how they add value? What are your perspectives? Things like brand, reputation, and or are you more into the more tangible things? What are your perspectives on that?
For me, it is one of the advices and one of the things I'm learning also. I think what CFOs need to be is to learn from the CFOs that have made it, to learn from the CFOs that are managing multinationals. Listen to their podcasts. listen to what they are saying. So listening to various people, I've learned that to be successful self, I think the most important thing you need to do is to learn the business. Learn the business. Know how do we make money? What is it that we do? So if, for example, at UNBS, the work that we do is customer protection from counterfeits, from bad things, then I must know that the intangible things like training consumers about looking for a sign of UNBS or a bottle of water to confirm it is expired is critical. So I'm not going to refuse giving PR a budget to make sure that people are aware of our role. And the moment you do not know what you do as a business or as an enterprise, you will not think of it as important. So it comes from knowing who are we, what do we do, what is our core value, what is our core business to the community, and then you move along. But also, it is important that the marketing team, PR teams, the brand managers are able to document that impact. Because if they document that impact, then they are helping you as a CFO to support them even better. Because in the boardroom, it's not only CFOs that refuse those budgets. Even other technologists will refuse those budgets. Yeah. And they say, no, it's us who go to the field, it's us who do this. But if also our colleagues in marketing on branding and PR can learn to document this impact, then it will definitely make sure that CFOs have no choice or not support. Right.
Going back to the issue of interviews. I mean, being the CFO, you started very many interviews. If was interviewing other people, and obviously the fact that I mean, maybe for every interview, only maybe one person will make it out. Are there some certain things that you noticed that make people fail interviews that you'd like to tell them next time you're going for an interview? This is what you must avoid. Otherwise, you know, to get that finance wrong.
Yeah. I actually thought about starting a Toho, maybe 10 years. And I also be like you, open up a YouTube channel just about how to pass interviews for the people that say, be my free, or the people that want to be mentored by me. By one biggest problem, and yes, you're right, I've conducted interviews for the last 10 years, finance professionals to get into the departments to supervise. And the biggest challenge that makes people fail interviews is confidence. The confidence that I can do this job. And then explanation of the how are you going to do the job. So somebody comes to you and they already look like, hey, the body language, the way they express themselves, they are not articulate. You can't hear what they are saying. They are asking you to repeat the question 3 times, meaning they are not ready. Is a turn-off. So people always think that I know my things, I'm technically good. No. In the interview room, I think, show that you're confident. Be articulate. Let's hear what you say. Say it with purpose. Say it with conviction that it is not all about you. Because people are looking for common sense at the workplace. Common sense is common, you believe. It should be that even if you have the technical skills, do you have common sense to do certain things without being directed? So I want to see that in the boardroom. And I think number 2, I want to hear you tell us that you did the job. People leave without even asking the question. People leave without even asking, when can I hear from you? How have I performed? Is there something that I need to clarify? People just leave. And then for me, the other turn off is it's somebody comes for an interview and the press court, honestly, even if you're a marketer, you must come in and I should see somebody who's going to stand in the audience and convince people to buy the product. So dress code is for me another turn off. Sometimes somebody comes in the interview room and to act. It's like they're visiting their grandmother. And then you're like, okay, will you escort me to can negotiate a loan in Sentinel? How are you going to dress up? So important things should be taken important, and people should really take them critically noted. So I think I've tried to answer that. It is more about confidence, more about being more articulate, communicate clearly. It's more about showing us that you can read the job and convince us that you can do the job. And then the typical things for me are about number 3 or 4, because I can train you. I will give you 15 months to train you on the technical things, but I need to see, are you trainable? Can you communicate clearly? Do you have interpersonal skills? Are you good to go?
Yeah. So I just want to understand at what point did you realize that you want kind of a nice person? Was it purposeful? Did you just kutomena and you found yourselves there? But also, of course, having found yourself there, how did you prepare yourself in terms of reskilling, retooling, and to get yourself to where you are? And in there, what are some of the key lessons that you picked that other rising professionals can pick up on?
Great. So I think as in my senior 2, when I had a sister graduated with a BCom, and after graduation, I saw her driving a car after like 2-3 months. And I'm like, oh, so I think accountants who do BCom drive cars after 2 months or something like that. And for me, I would not lie to you. That was the first inspiration to see my sister get into, I think it was Deloitte, yeah. And you imagine, you can't even tell where the car came from. But for me, loving cars and wanting to drive at that age, I'm like, I think this is the best profession. Initially, I wanted to be a priest. Makes the two of us. Yeah, I wanted to be a priest. But senior 2, I immediately developed my love for math even more. I booked my love for accounts, for commerce, and I did all those up to end of my O-level. And at A-level, I did make, because I still knew that is the pathway to commerce. But after graduation, from a BCom career, I was started on a job as a business development and public relations officer by Mr. Matthias Kataba, a finance trust, having been a PR person himself, a pride. And he said, you talk so eloquent. I want to be moving with you to grow the brand of Finance Trustee. And I loved it. Then I discovered 1 year later that PR and marketing were beautiful, but I didn't have any mentor other than him to tell me the areas to pursue. And my sister was now pressuring me to say, what is it? What is it that you're going to book? What is your career path? Decide now. And I had to make a decision, went to Matthias and told him, I think I need to take me to the branches and pursue my finance career that I trained for. So I went to the branches, became a teller, became a service person, went into branch accounting, and then my career student there. So I think it was an issue of having a mentor, having somebody I looked up to, I admired as a younger boy, something that I saw. I wanted to be a priest because in the village I used to see priests ride motorcycles. So and doing even chicken and matoke for free. So you understand, as a young man, the inspirations are completely different. But then when I grew up, I discovered that this is my passion. I love math. But also I discovered that accountants can work in any industry, anywhere. And that's something I learned with as in finance, was reading about finance. I discovered you can work anywhere. We are not limited. So I said, okay, if we are not limited, then this is the profession we should take in it. Yeah.
So what when did you buy your car?
Immediately after confirmation of my first job, I got my first.
And you felt like you had arrived.
I had the right. Make I was there. You know, as you're talking about you wanting to be a priest, I laugh because
Myself also wanted to be a priest. But to me, I was inspired because our priest at the time used to drive cars. So I think a priest in your village will poorer than enough. This is, yeah, yes, sir. Interesting. Yeah. So and now, can you give me, and I mean, along the way, did you feel, maybe did you do some other, maybe other reskilling or retooling, that had in some other milestone that you should give, have redefined your career?
Yeah, sure. So the retooling, like I've told you, was very focused. From A level, I decided I'm going for MEC because I know from there I can do a BCom, and I was like I got that on government. Then I went after in finance trust immediately. I took some time either because decision making on career was not easy. So it took me almost 4 years until 2011 when I made the decision to go and do postgraduate at UMI in financial management. And then I discovered that the postgraduate was still not taking me into where I wanted to be right last. The colleagues I was with in BCom were in Somalia, wherever, as accountants with the FCCAs are what. And I feared to do those things, thinking they were expensive or they were difficult. But in 2012, I made a decision to start my FCCA journey. At that time, I joined oil and gas, and I was working in Lucia. And I was given a very serious task of heading the accounts department, the starting organization. So I really needed professional skills. I started my CCA career at the end of 2012. And then I came to Sunday in 2013. At that time, I had really started to get deeper into FCCA. By 2015, I was a member of FCCA already. The other tooling I did is after that I discovered I needed a master because now I had come into management positions and I needed now to get onto the table of decision making, understand strategy a little bit more, understand managing people a little bit more, because FCCA gave me, of course, all the skills, technical, professional, and everything that I needed to master. So I chose to do a master's in corporate finance with Salford University in the UK, and that was around 2017, 2018, 2019. And then recently, about 2022, I had to do CPA, both script mandatory papers because I didn't do it. So I had to enroll for CPA. You're doing the regulators in a country. I also needed that membership. That's where I am now, and currently I've enrolled for CTA. I also want to have some skills a little bit more on the tax side. Yes, as CPA and FCCA, no tax, but with CTA, definitely you get to get more skills on how to advise clients on issues tax. And a lot of CPDs, I don't miss CPDs organized by professional bodies here, FCCA mainly. People here at FCCA will tell you I've attended all the AMCs, African Member Congresses here. I always attend my CPDs. So retooling myself is a continuous journey for me. I cannot relax. I keep learning every day. Yeah.
Okay. Any particular misconceptions that when you're joining a professional, when you see in school or you're still at the bottom ranks, that you always have things of, okay, I think this is what happens at the top, or this is what happens here. But not to get there and actually is that you're just dead wrong. Are there some things you discovered that you think about the profession that have changed and have brought you to reality and told you, do organize yourself. This is what you chose, and please stay.
I think for me, the most positive one is the perception that people have about finance people that we are thieves. I wanted to really experience how thieves we are, if for lack of a better word. And unfortunately, it's just those that have not probably professionalized me. Because when you become a professional accountant, then you're bound by ethics. We have a clear eco code of conduct. So the perception, I wanted to really find out are accountants really thieves? And I discovered there are those who call themselves accountants who are spoiling our name. So I'm happy that I discovered that actually it is an issue of ethics on that. But on the other side of things, I honestly thought accountants being people who work with the money and all that are supposed to be among the richest people. No, that one is not true. And I've told people, if you come into this profession thinking it's about making money, it's about being the rich guy, the building, you're targeting the wrong profession. I think it's more of added value, it's more of influence, it's more of insurance organizations can survive next year, 5 years, and in the years ahead. I think I have come to realize that very few people know that. Our biggest role, I think, is to make sure organizations survive and grow. Because you can't just survive without doing six. Grow and survive. It's not more about making life ourselves. And it's not a disappointment. And you're not the biggest earners. But it is a relief also. But our role and the value we add is incredible. And if you take it in and become comfortable, you're happy, live happy. Yeah.
How do you manage that whole thing of, and I already say this is a lot of finance people at this chair or the person in the home who is cooking the meat for the family. They are looking at the meat, even when no one is around. Once in a while, I can have a chance to pick a piece of meat and nobody will notice. But having that patience to wait for everybody and they sit, they serve, everybody gets their due. How do you, drawing on your experience, like how do you, I mean, I'm sure you still in a place where you know what everybody else is earning, you look at them, you're like, but this one, so what are they even doing? But they're like, anyway, this is my money, let me take this, and everybody gets theirs. And how do you put yourself into that space where you are calculating? I mean, forget about what they say about code of conduct. It's about a special kind of skill and contentment, and even a coping mechanism. Because suppose once in a while, I'm sure everybody has challenges, but you come to work, you look at people's money, and you walk away and saying, "This is not my money." Take it.
I think CFOs have those that think alike on my side. We are like a chicken that has about 10 chicks. It is more fulfilling for any CFO to see the organization and its people will grow. Because if you're part of them, then you're growing with that family. And it is very difficult for some people, but for me, it's something that I have come to realize that, for example, if I push my team members to be better and to tell them to look at themselves as opposed to what they're getting from the organization in terms of financial benefits, I have come to discover that it fulfills me. Today, 5 years later, for somebody I work with to call me and say, you did a wonderful thing in my life. So we work with the assumption that resources are limited, and they are always limited. So we must think for the organization, we must think for people as opposed to for ourselves. Because if the organization grows, I grow with it. I'll give an example. Because resources are limited, sometimes if you concentrate on people, there's a way you benefit as an individual. So if, for example, we use not to provide lunch, the hospital there in Isage. And it's one of the things I struggled with my previous tele, Dr. Blunibame, God rest his soul in peace, for people to eat food. And people had, no, give us money, we want salary, one salary. Now, if you think as a CFO, that money on people's account is what's going to make them do their job. You're wrong. So because resources are limited, you must look beyond what you have and look at certain things you can give people, like a CFO, to make them do better, grow the organization, and as it grows, salaries increase, the organization grows, and you grow with them. So we started to give people food, and people started to take care of patients better. And that created an enormous increase in patient numbers. And guess what? In a revenue. And guess what? The salaries they wanted came. So you must be very strict with the resources. And I think very, very critically. Yeah.
So are you saying that timeliness is give bad injections? Okay.
And they have to work. I mean, imagine a guy if Tina impacts a tub of cement on 30 floor we construct, you will be delayed. Imagine 100 guy but driving it to Buru without food. You will crash.
Yeah. Actually, what are you saying is that sometimes it's not all about money. You need to try and interrogate that further, but then you fill out where you can be able to put your limited resources to best use to get better results. Yeah, interesting. All right, and I mean, as a CFO in the healthcare sector, but also as well as not-for-profits, I'm sure there are certain trends that are emerging. There could be, I mean, finance, yeah, but there's some certain trends that I imagine that are unique to certain sectors that you see both, especially globally. You could say those are easy to document. I think in the more developed markets, they do lots more research, they do lots more writing, which you don't see a lot on our side of the world. So, but from your personal space, what are some of the key emerging trends that anybody seeking or playing in the healthcare space or in the not-for-profit space need to be looking out for them to, one, to be able to add values to the organizations better, but also to help them grow as individuals and as professionals?
Thanks for that. The biggest one that is coming now is in the not-for-profit sector. It's the declining donor aid, basically. And of course, it has very many players around it. And as finance professionals, therefore, we need to be very innovative in terms of sustainability, how we're going to sustain ourselves with the declining aid that we are seeing. I mean, the US, for example, who are the biggest donors, most NGOs and not-for-profit organizations in our country, has just gone through a transition in leadership. And it always does every 4 years. And it always comes with different policies. As finance leader, you should be in position to know what are the policies of the coming government. Is it restrictive in funding HIV? If I'm in HIV, is it restrictive in banning child rights if I'm in that area? And if so, then what am I going to do? And some of the solutions revolve around governance to ensure that there is mobilization of local fundables. I have told colleagues in the not-for-profit sector that there's a lot of local funding, but I don't know why we tend to think it's only external funding that's available. As long as you're able to document your social impact and you're actually able to show in the communities, I think there are people of goodwill also who can supplement the declining donor aid. I think the second trend that we are seeing is AI and ICT governments. Artificial intelligence is coming very critically. So as CFOs, we need to embrace, we need to adapt and be learn and learn. If we don't, we are going to stay behind because information is supposed to now be very accurate, is supposed to be quick. You must just click here and there and you have a report in a second. Our role now should be analysis. The trends dictate that CFOs should not take a lot of their time into reconciliations, data entry. We should now be using technology to give us reports and make quicker reports, because then donors, regulators, government agencies, stakeholders who need to see what are you doing so that I can supplement it. So AI and technology are coming up very serious. But of course, the third area is regulatory compliance. People used to think, we are an NGO. Nobody's going to come and touch us. We can't do away with the taxes. We don't need to pay taxes. We don't need to pay for our employees. We don't need to pay necessary for employees. That income tax, we are NGO. No. Things have changed. They will knock on your door if you're not compliant, and they will close your shop. Regardless of which service you offer, they will definitely close you up. So it's important for CFOs to realize that the regulatory space has become very complex, and we need to be compliant. There is no shortcut to be compliant with the regulators and ensuring that you're in good books with the political players, the stakeholders around it. Yeah, I think those are the ones I can tell. But the last one, of course, is people. We are talking Gen Zs, from Gen Xs, from Gen whatever. So we need also to realize that the colleagues in office now, below 30 years old, are completely different. So the way we handle people is also going to define how we survive in the not-for-profit space, but also in all spaces. And it is okay for somebody today to arrive at office at midday. What matters is, do they have results? It's no longer an issue clock in at 8 and you clocked it at 8:30 and look at your side. If you do that, you're not going to have any quality people around you. But also, these guys need constant training. They need constant motivation. They need to explore many things. So if they're in accounting, let them work with the marketing team once in a while. Then in marketing, let them attend meetings in operations once in a while, because they don't want to do one thing and they will get bored easily and leave. So people is another trend that we should be very cognizant of as a changing factor. And if you cannot retain good people, they will take them and you keep recruiting, which is expensive. Yeah. So for me, I think those four are critical. It could be honest, but now I'll end on those ones for now.
Why you mentioned something about a good CFO, how can they have good conversations with each banker? And then I know one of the big roles of a CFO is especially in the trading landscape, is to be able to have proper engagement with different stakeholders, bankers, regulators, customers, the community. And from our conversations, and every good CFO from time to time, you must be able to have hard conversations. Stick to your, but basically we people over to the organization or to your position. Any particular tips and lessons that you feel you've learned from engaging, and I'm even what we're also sharing about. It's also about how, even for the clients, depending on how they engage with the institution, in this case the hospital, you could get different results based on how you engage. Any particular lessons you've learned that you'd like to share with other leaders on the power of proper engagement?
Oh, yeah. It still starts, for me, it starts with, what do I need? What am I coming to tell my banker who? What am I negotiating with my banker? What do I need with my suppliers? What do I need with my customers? So the entire stakeholder analysis involves understanding what you need with your stakeholders. For example, you want to negotiate with suppliers. Are you looking for better quality regardless of cost? Or you're looking for lower cost regardless of quality? Or you're looking for better terms because of cash flow challenges? So with your banker, are you looking for responsiveness in terms of better products to support your business? with your customers? I mean, are you looking for loyalty in terms of what you're offering so that they can stick with you? Are you looking for feedback so that they are always so for me it is what do I need to go to discuss with this stakeholder? The challenge we have as CFOs is we engage with stakeholders in our desks, in our chairs, as if they are doing us a favor. And that's definitely where we get it wrong. The stakeholders in all businesses are doing us a favor. So it is us to go to them with a humble mind of, I am here to discuss this. I'll just give an example of regulators. If you've not paid your taxes, UIA has a desk where you can negotiate stormate payments. But if you go in there to bang tables saying these things are wrong, they will not listen to you. So you need to know, what am I going to discuss with my stakeholder? Who is the stakeholder? What should I benefit? So I think for me the tips is know what you want to understand your requirement, in other words, and ensure that requirement is backed up by result also, because in health sector, for example, they are struggling with payment of bills from insurance companies. Now, GMS wants to be paid. Abacus wants to be paid 30 days, but UAP is paying you 90 days. So you go to Abacus and GMS as your suppliers and tell them, I am serving 60% of my patients on insurance. I'm being paid in 130 days. I am here to beg. That will relax the payment terms on the medicines you need. You must be clear, but you must back it up with the reason. And the reason is cash flow. I'm getting money after 130 days of serving a patient, so please give me 90 days as I try to work off it. So that is reason and purpose. So that's why I can't say we in that area.
There's something mentioned, there's a misconception out there about insurance clients, that they tend to get poor quality service compared to the cash plans. Is that the reason, because their money comes late?
No. I think it is really the misconception, like you said it. And it depends on the institution values or the hospital philosophy. Surprisingly, I know hospitals where insurance clients are the kings. They're like put in a certain corner with water and everything. And then the cash paying guys are just lining up as if they are, and yet they're the ones bringing in the cash immediately. Definitely, I know that for sure. I mean, go to hospitals that are seeing more than probably 70% of their patients on insurance. They have better facilities. They have better waiting areas. They have better screens of TV and DSTV. Now, you go to a hospital that is purely cash and only. They are seated on benches. and some are standing up. So for me, it is a real typical misconception. But yes, insurance companies also put caps and limits. And I think that's where people misunderstood the concept. They put limits, they put exclusions. So if you are not able to give you multivitamins, you might have banged the table and you say it is the hospital. But it's your insurance say no multivitamins.
Yeah, okay. I mean, have you been in the healthcare space? What are some of the things you think? I mean, when I become president very soon, and I appoint a Minister of Health, how do you think we can fix public health? What do you think can be done to switch up a few things and make our, especially the public healthcare system, better? Yeah, what are some of the views on that? Because I know, having worked in private healthcare and especially finance, you probably have a little bit more insights in terms of how a few things can be fixed, especially at the individual get care allocations.
Yeah. I think if I met General Honorable, I'll tell her to fix the most important thing, and that is according to me, is availability of the healthcare workers. We will need to find a way to make people be available in these facilities. In One World Health, where I am, the reason we exist in One World Health is because of the gap that is created public sector health facilities. And the gap is lack of nurses and lack of healthcare workers. Simple. So the things to fix are clear. And how do you fix that? Manage people. Human beings are difficult to manage, but also very easy to manage. You are available, I'm good with you. You're not available, I sack you tomorrow. I don't know why it is difficult for our countries in Africa to do that. Yet in Singapore they do it.
Don't sack voters like that. Jesus.
I mean, we need to take that away. We need to hire clear professionals that can manage people, that can manage processes, and can instill discipline. You're on duty, but you're not on duty. And there's a mother to deliver. It is unacceptable. So motivation, and I think with motivation, it is simple. Motivation comes with good pay. Definitely, healthcare workers need to be paid better. That one is a must. And of course, the other motivation is availability of medicines and equipment. I have had doctors, friends, nurses, who tell you now I'm going to be there to deliver a mother, but I don't even have bloods. So I can't be motivated to be my job. This mother might be a risky mother. I'm going to theater, but there's no electricity. So there's a lot, but it is not actually too much. Equip the hospitals, let them have all the tools of work, and then let there be the skill and pay people well. I think for me, if you give me the position, it will be finance minister. It will be those things to look with my colleague, Minister of Health.
Okay, interesting. So as when do you have any particular philosophy that guides you in terms of your leadership style? And then also, do you purpose to say, okay, maybe every place I go, I need to leave this certain legacy, or this is how I need to be remembered when I have left?
Yeah. Oh, definitely I do have. My leadership style is I always pray to be a leader that is approachable. I operate an open office, and I make sure I am approachable, even with the least person on the payroll, a cleaner, a situated guard. Because those are the people who are going to tell you, so and so's car is taken out medicines in the boot. Those are the people who are going to tell you, as I was mopping the ward, patients were complaining that they were selling to us blood to you. So my leadership style is one where I don't even try, I pray about doing that I am approachable by each and every one, so that I'm able to understand the environment I'm working with. Number two is I tend to try and be as technical as possible in what I do, so that I can method teach. Let me tell you, it is embarrassing to be a leader who cannot prepare a balance sheet for us as a CFO. Now, how do you tell the guy, I need that balance sheet? The guy is stuck, he can't produce the balance sheet. You're just also there seated. How do you go to the boardroom and say, my officer was not ready? Ooh. So in everything I do, I also try to make sure that I teach people around me to do their job better, because it relieves me. And so by doing that, I try to make sure I know my staff hands-on, so that I'm not embarrassed, and so that I'm able to train and mentor other people. Legacy-wise, for me, it depends on the industry. It depends on the organization, how I follow it and how I want to leave it. I'm happy that I left One World Health as somebody who has helped to develop systems. It is like running a country that has systems. Even if the entire cabinet died when we were watching, we see that happen in the US, we see that happen in the UK, we see that happen in many governments. So when I went to One World Health, we lacked systems of how things should be done in procurement, in inventory management, in finance. And what I am happy that I've left there, what people told me in the farewell party, is that I've left systems that are working. So it depends on the organization. Some organizations, you want to live as a mentor, you want to live as a good colleague. Others, you want to live as somebody who helped the organization to grow. Others, you want to live as somebody who started some. So legacy depends on the organization. And for me, I always struggle to make sure I learn the organization and say, okay, this is going to be my focus. I've just told you on UNBS, I'm a CFO, but for me, it's reputation. And that reputation will reflect in how are our financial statements. Do they reflect a true picture? How does the public understand our services? And for that, it will be an achievement. Yeah.
All right, thank you very much, Robert Kakooza. It's been an interesting conversation, most of it non-financial, but I think like we've come to agree, though, for those of you who have been following the show, I think right from I don't remember what they say, I think it was Fiona and Wamanya who said that looks like these days finance people are, there's a part in when you're signing a job contract that says, and any other duty assigned by a business, looks like most finance managers nowadays are doing more of any other duty assigned by a business.
More with regards to value officers' interests now.
Thank you, Robert, for that wonderful conversation. I think this is a nice way to start the year. It helps us to put ourselves in the right frame of mind, make our projections, organize our house so we can have yet another great year. Or if you had a bad year last year, this is the time for you to reshape yourself, dust your shoes, and get back into the fight this time, more skilled, more equipped. And of course, one of the key things you need to keep in your fighting, in your war room, is you have to watch the CFO Playbook, because it's where finance leaders get to share their experiences. And like they say, you don't have to revert the way. Some of the things have been faced by people, they have gone through them, and they've given you a chance to share via the CFO Playbook. So do follow, do like us, and keep engaged and share with your friends within the profession. And see you next time. Thank you, Deloitte Uganda and FCCA Uganda, for making this possible. And see you on the next show.
CFO Playbook by CEO East Africa Magazine in association with FCCA Uganda and Deloitte.